welcome all who have joined us this evening on Facebook, Instagram, Zoom, and other platforms. We would also like to welcome our presenters, Dr. Michelle Halyard from Mayo Clinic School of Medicine, and Dr. Karen Wise from Arizona Cancer Center, as well as myself, Dr. Angela Allen from the National Institute of Health, All of Us Research. All of Us Research Program, University of Arizona and Banner Health teamed up with local health experts to discuss how breast cancer affects the African Americans in the community. During these presentations, we would like for you to understand how disparities in healthcare treatment and outcomes impact overall quality of life for women affected, and how mental health interventions during the treatment process play a part. We encourage you to ask the two cancer experts your questions during the Q&A and find out how you participate in a health research program to help shape the future of healthcare. Our panelists will spend about 15 minutes. We will basically give a brief introduction of each, and they will go into detail of what they'll be sharing today, so that each presenter has an opportunity to present thoroughly. We ask that you place your questions in the chat, Q&A, and also hold on to your questions so that we can entertain them at the very end. We'd like to start off with our first presenter, Dr. Michelle Halyard. Dr. Michelle Halyard will be presenting on breast cancer awareness, what every woman and man needs to know. Let me give you a little bit of information on Dr. Michelle Halyard. So Dr. Michelle Halyard is an esteemed radiation oncologist who lends her expertise to the Mayo Clinic School of Medicine, serving as the Susan Hansen Poole Vice Chair, Professor of Radiation Oncology, and the Dean of the Arizona campus. In addition, she is the co-founder of the Coalition of Blacks Against Breast Cancer. Her primary research focus is in the clinical significance and implementation of quality of life assessment in oncology clinical practice. Her work has contributed to over 60 publications, and her impact on women's health in Arizona awarded her an induction in the 2020 Arizona Women's Hall of Fame. I now lend you to Dr. Michelle Halyard.
Thank you very much, Dr. Allen, and I'm really it's a great pleasure to be here this evening. Breast Cancer Awareness Month is such an important month because of the impact that breast cancer has on all of us. And you'll see the title of my talk is What Every Woman and Man Needs to Know, because number one, breast cancer not only impacts women, it impacts men as well. And even if men are not the patients, they are often the support system for the women with breast cancer. So next slide. So there are a lot of cases of breast cancer that are diagnosed. In the United States, almost close to 300,000 women are diagnosed with breast cancer and about 2,600 men. And again, a lot of times people don't think about men getting breast cancer, but particularly if there's a strong family history, men can get breast cancer too. Importantly, there are millions and millions of breast cancer survivors worldwide. And so although some people, when they receive a breast cancer diagnosis, think immediately that they're going to die, I think it's really important that you know that not only can women survive breast cancer, but they can thrive. Next slide, please. So I think it's important to know when we look at breast cancer in the Black community, as well as the Hispanic community, that the incidence is not really higher than the white population. It's important also to know, as I mentioned before, that you can survive breast cancer. 80% of women of color with breast cancer are alive at 5 years, and greater than 90% who have localized breast cancer where it has not spread or it's not a large tumor can be cured. Death rates are decreasing. And I know later on in the program, we'll be talking about the importance of research, particularly in the Black community. And that has really contributed to the fact that more and more women who are diagnosed with breast cancer are surviving. Next slide. So there is good news that women can do very well with breast cancer, but there is still some not so good news, as I call it. Overall, the survival of breast cancer in Black women can be lower than other racial ethnic groups. And there are a variety of reasons for this. One is that we tend to develop a more aggressive form of breast cancer called triple negative breast cancer. And this is a type of breast cancer that is more frequently seen in women of African descent, so African American, African descent. And it also importantly occurs in women at a younger age. On average, most women develop breast cancer in their late 50s to 60s, but triple negative can occur earlier. Also, breast cancer can occur in African American women or other Black women as a higher grade or more aggressive. Not infrequently, we have a later stage at diagnosis of breast cancer. Again, some due to biology, but some due to less access to high quality, timely care. And also, there are more comorbidities, as we call it in healthcare, or underlying illnesses, which can impact breast cancer survival. Next slide. So it's really, really important that we know what is normal for us so that we can actually report to our healthcare providers when something is abnormal. So many of my patients, prior to their breast cancer diagnosis, they would say, you know, I just don't know what to look for or what's abnormal. So one of the things that I say to patients is really make sure that you're doing your breast self-exam regularly. And so we've really taken away the recommendations of doing it monthly and a particular day, but that still does not mean that you should not examine your breasts and know what they look like. So what I say to women is, first of all, take a look at your breasts in a mirror. Have you noticed changes from 1 month to another, from 1 week to another? Sometimes from 1 day to another. So you're looking for changes in the size of the breast. Is one breast swollen compared to the other? Is there dimpling or puckering of the skin where it looks like an orange peel? Is there redness? Or sometimes in women with darker skin, there might be almost a bruising appearance. You're looking for anything that is just different, including, has your nipple changed? Is it pulling in? It's also important to know what your breast feels like. So I also encourage women to feel their breasts, first lying down perhaps in the bed or someplace else that's comfortable, and feel every aspect of your breast. Many women are just looking for a knot or a lump in the breast, but breast cancer can feel differently in different ways. So do you feel a hard lump, a knot, thickening, or something that's just different? And don't forget to feel up into your armpit because the breast extends up there too. You also want to understand if there's any painful areas in the breast. Now, most breast cancer doesn't hurt, but sometimes it can. And it's important, if you find something, go to your provider, your doctor, your mid-level provider, whoever provides your health care, or if you don't have somebody, still seek care. It's important to know that the vast majority of things that you find in your breast are benign on physical exam. So don't be paralyzed, but also don't use that as a false sense of security. If something's changed, see a provider. Next slide. Early detection is the key. So not only is physical exam important, but having a mammogram is important. So I always encourage people to talk to your doctor or your mid-level nurse provider, anybody that's seeing you, about which screening tests are right for you. The gold standard for following or diagnosing breast cancer is still mammography. Often people ask, can I have a mammogram, or can I have an MRI, or can I have some type of an other imaging study? But mammogram is still the gold standard and picks up about 90% of breast cancers. However, if your mammogram is negative and something is still abnormal, keep pressing until you get an answer. There are a variety of different guidelines that talk about how frequently women should have a mammogram. What we recommend at my institution, as well as the American Cancer Society, recommends starting having your mammogram at age 40 if you're at average risk, meaning that you don't have some type of known biologic or genetic factor that predisposes you to breast cancer. If you're at high risk, for example, if you have a mother that was diagnosed at age 43, as mine was, you actually need to start screening about 10 years earlier. So the U.S. Preventative Task Force is a body that puts out guidelines for mammography screening. What they say is that there should be an individualized approach between ages 40 to 49 as to when women start their screening. And they recommend screening ages 50 through 74 every 2 years. Although, again, certain organizations suggest every year. Talk with your healthcare provider. When should you stop screening? The Preventative Task Force says about age 75, but if you're very healthy and you have no other illnesses that are threatening your life, you may choose with your doctor to screen beyond that. And importantly, mammograms are okay even in the pandemic. We saw a drop off not only in mammograms, but in other preventative services during the pandemic. People were afraid to go out. They were afraid to go into doctor's offices. But I would say that even in the height of the pandemic, mammography screening centers were taking great precautions to keep people healthy. So don't let the pandemic keep you from getting your mammogram. Next slide. So what can you do to lower your risk? Maintain a healthy weight, exercise, add that into your routine. That helps with weight. Limit alcohol intake. We have data that suggests that menopausal hormone use can elevate the risk of breast cancer. So some of the benefits that we thought previously about benefit to heart and bone disease have not really kind of panned out like we thought. So limiting postmenopausal hormone use is important, and breastfeed if you can. All of these things have shown to be beneficial in lowering your risk. Next slide. So if you are diagnosed with breast cancer, I want to tell you about an organization that has been going for about 11 years. It's an organization that was formed by 3 community organizations, the Phoenix chapter of the Lynx, Sigma Pi Phi Fraternity, and Mayo Clinic. And it's called the Coalition of Blacks Against Breast Cancer. It's an organization that targets Black breast cancer survivors, anybody of African descent. And it helps to support breast cancer survivors, which is anybody that from diagnosis forward, and their loved ones. There's really 2 parts to this. There's the support group, and there's also community outreach and education. And we have many of our survivors that are sharing their stories to talk about the importance of breast screening and taking care of yourself and seeking care. So our website is listed, cbbcaz.org. If you want us to reach out to you, it's info@cbbcaz.org. We meet the 3rd Sunday of every month from 3 to 5 p.m. Prior to the pandemic, we were meeting in person at the Cancer Support Community in downtown Phoenix, and Dr. Allen and colleagues helped us start another center in the West Valley in Peoria at Antioch Church of God in Christ. We hope once things simmer down with the pandemic, we'll be able to get back in person again. But right now we're holding it virtually. So shoot us an email, we'll get you on the distribution list, and we meet via Zoom. And we also have educational sessions as part of our sessions each month that we stream to Facebook Live. So thank you so much for allowing me to be here, and I look forward to answering questions. Thank you, Dr. Allen.
Thank you very much, Dr. Halyard. And it is us that must thank you, not only for the great work that you've done in the community, but also for the establishment of the Coalition of Blacks Against Breast Cancer. And she is correct. I am part of the one of the lead supporters on the West Valley, because I believe that unfortunate situations occur everywhere. This program has been very, very helpful, not only to the people that we've reached out to in the community, but it's also been helpful to me as a healthcare provider, as an educator, educating the community on what is a great need. I know I'm putting a plug in, but I have to say this. We recently had 2 wonderful events, one on October the 10th in the West Valley where we had a large number of our members and community personnel that actually got involved with having mammograms. And I can tell you right now, I'm going to throw this out there. We had free mammogram screening, and the individual who ran that program said that it was such an honor to see that we had over 35 Black women, African-American women, getting screened. And I think that is so important because they're not only looking at what have happened, those who have actually had a breast cancer, but what could happen. And that's what we call preventive care. So again, I know we have our next presenter, but I do want to keep this slide up for a while because I want all of those who are viewing this, that if you have any questions towards the end about this wonderful program, again, look at the website. They have, one thing I love about it is the persons who put this program together, the chairs, the leaders, they are not in most of these website pages. It is those who are survivors that are telling their story. And I think that's so important when you're hearing it from the person who is actually experiencing those concerns. We've also had opportunities where we had the survivors' family members share it as well. And then on October the 16th, we had an awesome event where we had the kickoff, and that particular program allowed us to raise funds for this wonderful program. So I believe, Dr. Halyard, I know that's a question that'll be asked later, but there's opportunity for people to give to this organization as well. Am I not correct?
Most definitely. And if you go on our website, there certainly is. And just a plug, in my last 30 seconds, we are starting a coalition of Blacks against prostate cancer.
Yes.
So stay tuned for that. The CBBC, the Breast Cancer Organization, has been going for 11 years, and we're looking forward now to serving the men in our community. So thanks again, Dr. Allen, for the plug.
Thank you. So we'll move on to our next presenter. And our next presenter is actually Karen Wise, and she's going to be talking about breast cancer and mental health. So I'll share a little bit about Dr. Karen Wise. She is a professor of psychiatry at the University of Arizona College of Medicine, Tucson, and the director of psychosocial support and psycho-oncology services in the Arizona Cancer Center. Her research focuses on family processes and emotion regulations as they affect both mental and disease progression in patients with cancer and end-stage renal disease. This has informed her development of a collaborative model for addressing cancer patients' mental health, which focuses on the inclusion of social workers and psychiatrists in cancer patient care, in addition to oncologists. I'll hand it over to you, Dr. Wise.
Well, thank you so much for that lovely introduction. And let me begin by just saying how exciting I find it to hear about the Coalition of Blacks Against Breast Cancer. I had not been aware of your organization, and I will definitely be sharing information about it with people down here in Tucson, since you do it virtually. They don't have to be in Phoenix to participate. So as you'll hear me say, social support is just key to well-being in women with breast cancer and for women who are supporting others with breast cancer. And I think it's really important that we not overlook the experience of those people who are supporting the patients as they get through cancer. And I'll say a little more about that. But you already heard from Dr. Halyard that, there's about 250,000 women every year in the United States who are newly diagnosed. And we know that the impact of cancer just doesn't go for that first year. It goes on for years and years afterwards as women are making adjustments to the impacts and the changes that have occurred as a result of their cancer. So as you also heard, there's often never a expectation that a person will get breast cancer. And so the initial experience is generally just quite shock and confusion and fear, obviously, of what's this going to mean for me and for my family members. And I think what can sometimes get overlooked is that the emotional experience of that, coming to grips with that initially, really sets the stage for how a person can then take on all the challenges. So I am fortunate to have a group of oncologists and surgeons that I work with and social workers, all of whom have, I think, come to be more attuned to that importance of that initial engagement and initial indication that there's a team here for you. And I want to also give a shout out to Dr. Halyard, who said, you know, if you're not getting answers to the questions that you have about something that's changed in your breast, don't take no for an answer. Unfortunately, we know that there is discrimination against people of color, and expectations for their importance of their voices being heard is not universal. So I really, really applaud that advice, and also want to encourage all of you with family members as well as patients to make sure the people you care about are getting those mammograms and following up on their care. I think we know that there's been a lot of drop off of preventive care during COVID, as Dr. Allen said. So I'm sure we have some catching up to do. And it can be scary, especially it's been scary for everybody to go out of the house because you're afraid you're going to get COVID. So on top of that, to face maybe what might be a scary medical procedure can be quite difficult. And again, if we can join together, provide support for one another, I just think it's going to make the whole thing go smoother and more people will get the care that they deserve. Next slide. So it can be one of the most distressing events that a woman experiences. And fortunately, the intensity of distress passes generally after the first few days or weeks, but it is a lengthy treatment process for many, many women. And the need for ongoing problem solving, ongoing processing is just really important to emphasize. We know that in families, when there's something new that's shocking, people can all join, gather around, offer support. But then if there's not ongoing communication about how that person's doing and what they need, the support can drop off. And important for those of you who are support people to remember, just check in on those patients and loved ones. One of the important times to do this is at the annual anniversary of the woman getting diagnosed. That can often just be a very important marker where more support is needed. Next slide. So strong feelings of being sad or anxious, as well as just scared, uncertain, and lonely, as well as feeling very sort of betrayed by your own body, are frequently things that women and men with breast cancer go through. And there's a lot of stress with cancer that includes not just the medical part, but also worries about how you're going to get to and from your appointments and how is your insurance going to work. And again, all those stressors are important to remember that there's people to ask. And I would really encourage you to make use of all the resources of social workers and community organizations like we've just talked about to get the questions about everything that you're wondering about addressed. And as I said, our loved ones and we call them now cancer co-survivors, because going through treatment for breast cancer with your spouse or with your mom or with your daughter or your aunt is just very, very difficult and stressful for the co-survivor as well as the patient. So really want to emphasize that even though people say, oh, I'll get through this, you know, I've gotten through a lot of other difficult things in my life, that kind of attitude of minimizing the needs can be kind of a warning sign, and important to notice if that's happening and try to understand it so that you don't overlook opportunities to get the treatment and the support that's needed. Next slide. So anxiety is very, very common, and depression also occurs quite frequently at some point along the survivorship continuum. It's not always at the beginning. One thing we see is that women and men with breast cancer get very involved in getting the treatment, and they're very involved with the nurses and the team that's treating them and their family members who are taking them to treatment. And then when they come to the end of that initial treatment period, maybe 3, 6, 9 months later, there can be quite a feeling of, oh my, what have I just gone through? It's like all the attention on the treatment has sometimes kept people from recognizing the emotional experience that they're having. And so those emotions can really start to come out after the initial treatment is completed. So if that happens to you and it somehow doesn't make sense, just remember that that's a common experience. Another thing I want to address is the difference between strong emotional experiences and feelings while you're going through this, which is totally normal and important to let yourself feel, as compared to symptoms of anxiety or depression or loneliness that are really starting to get in the way of being able to do things that you need to do. Next slide. So that just takes me to this issue of sometimes the impulse to avoid all of that distress, to, you know, buck up and be a strong person and let people know that you're getting through this just fine, thank you. We know that there is a way in which African American and Black women especially have developed ways of functioning that are thought of as a Black superwoman approach to life. You all have such crucial and important and major roles in the lives of your family and community, as well as advancing yourselves, that habit of just over functioning can make it particularly difficult in a situation where now you're in a position of the one needing help. It can feel quite uncomfortable, and certainly doesn't mean that you're any less super, but just indicates that you're using your great capacity to offer yourself and be a good role model for other women who need to take care of themselves. Of course, using alcohol or other substances can seem like a quick fix sometimes when we're feeling terrible, but that really just can compound the problem and add to additional difficulties. Next slide. So what to do? First and foremost, I hope that's obvious from what I've already been saying, accepting that this is a difficult experience, that of course you're going to have strong feelings. We all have feelings. Those feelings give us information about what we need. So by stepping back and noticing those feelings, we can learn a lot from what they're telling us. If we're feeling afraid, that means that there's something threatening us that we need to understand and take charge of. If we're feeling angry, it's probably because somebody's getting in our way, or somehow we're not getting what we need. And so paying attention to those feelings can then tell us, okay, this is what I need to do next. And just reminding yourself, as I said, that it's a difficult time for anyone. Next slide. So also talking to loved ones and or a therapist can sometimes be important. And especially, as I said, if you find that the distress doesn't come and go, if it persists from one day to the next, or interferes with sleep, or leads to feeling like you want to pull away from your friends, those are all indications that this is a clinical problem, and seeking out a clinician, a counselor, a therapist, a primary care doctor, somebody in your community, to share how the experience is impacting you, and then going ahead to use that opportunity to talk things through to get the help that you need. Because we know that if a clinical depression or clinical traumatic stress syndrome is developing, that getting treatment will shorten up the impact that that'll have on a person's life. Next slide. Dr. Halyard already mentioned physical fitness and care for your body. The mind and the body really are one. And we need to be taking care of our bodies in order for our minds and our sense of confidence in ourselves to be maintained. And it can sometimes be easy to just sort of forget about other health needs when a woman is so focused on getting treatment, paying for the treatment, taking care of household activities that are just still there. And again, that's where co-survivors and family community supports can just be so helpful in encouraging and providing assistance for those other things to make it possible for you as a cancer survivor to be exercising, getting enough rest, eating well, all those things that are going to get you through to a successful outcome, most likely. Next slide, please. Again, as I said, that mind and body are one. And so recognizing that what you're going through, what you're feeling, what your loved one is feeling may be confusing, it may be off-putting, it may be hard to get through to yourself or to others. And that's normal. So don't give up, just speak up, be a good listener, and you'll figure these things out. Getting your team together really can be very gratifying for your team members as well as for you. I expect many of you on this webinar right now know people who have breast cancer or have gone through breast cancer yourself. So I'm probably preaching to many people already in the choir about how good it feels to be able to help out and how blessed a person can feel when they get the genuine indication that others are there to help. So next slide.
I think the next slide is where I'm going to take over.
Okay.
But before we move over to the next slide, I'd like to stay on this one for a moment. Dr. White, I appreciate all that you've shared. While you were talking, I started thinking about definitions, and our viewers and listeners, I'd like for you to focus on certain things. The World Health Organization defines health as physical, mental, and social well-being. It's a definition that's been given to us to define how we perceive health. But there's a model called the Health Traditions Model. And that model defines health as a physical, mental, and spiritual balance. And when I think of the African American community, that's what I think of. When I thought of your presentation, that's what I thought of. looking at a person going through and battling such what I consider a challenging disease such as cancer alone, but breast cancer, they have to have that true balance. And the only person that can really define that is that individual. They have to know what their physical aspect is. They have to know where they are mentally. And if their spiritual being, it doesn't have to be religion, if their spiritual being is meditation, yoga, they have to actually have that balance. But what they have to have, more importantly, from what I'm hearing, is they have to have that support system too, that recognizes what that balance is. And I think I'm speaking to Dr. Halyard. I've heard her speak in the past, and I'll be sharing also towards the end on my presentation. But in order for that individual, sometimes a person who's going through this situation, they may say, I like to walk more. I like to do some exercise. I like to focus on getting myself back physically. If that's where they're spending most of their percentage of balancing their health, then allow them to do so. I think supporting them in that. And I think sometimes we hover over our patients who have actually gone through breast cancer or any type of illness and letting them know they can't do. But that's the problem. They do. They're independent. They are willing to say, I know when I need to stop. When we look at mental doesn't necessarily mean focusing on reading and understanding what's going on. Mental can merely mean focusing on family. When we see our women going through this challenging time and they want to spend more time with their children or their grandchildren. And I know in our support group, we've heard one presenter talk about how she loves spending time with her grandchildren. Allow that to happen. That may not be a lot for that individual. It's something they choose to do. And then, of course, we talk about spiritual, and most in the African-American community, spiritual has been considered religion. Allow them to pray more or spend time with their spiritual family, fellowship, worship, go to certain Bible bands so that they can feel like they are actually paying back, if you could say, things that God has given them, which is life and an opportunity to be independent. So thank you so much. I'm just kind of thinking about some of the things that you shared, and I think we have to really focus on health traditions, the capitalized version of health, allowing that person to be physically, mentally, and spiritually balanced is what's most important in this aspect. So I thank you so much. I appreciate you.
Well, I appreciate the opportunity. And let me just say that my research began when I was working in Washington, D.C., and a large number of my patients were African-American women. So I have a strong sense of the importance of spirituality and support systems. And as a matter of fact, I did a study that showed that women who have a support system of 3 to 5 people actually live longer after they have breast cancer. If you've got 20, that's probably too many because you don't have the energy for 20.
Right.
And if you don't have 3 or 4, it's not enough.
Thank you. I appreciate it so much. This is great. We'll move on to our next slide. And the next slide is myself. I'll be talking about All of Us Research and the All of Us Research program. So we'll move to the next slide, and I will be introducing myself. I'll share a little bit about my background. I'm a community research scientist with the Arizona Community Engagement Alliance against COVID. And that's actually the COVID program that is going on now called SEAL. We focus on health disparities. So we will basically look at obviously the minority population and how we can actually increase and also decrease mistrust, but increase an understanding of what's going on with COVID. Also, I'm Associate Clinical Research Program Director at Banner and a Clinical Assistant Professor at Arizona State University. I serve as the chair and honored to be a chair of the PEB, which is called the Participatory Engagement Board for the All of Us research team here in U of A and Banner Health. I'm heavily involved in the community, and I have to say that myself because I didn't realize how involved I was basically with working with the community, not only in the Central Valley, but also the West and now in the East. I work on mentorship programs through the National Black Nurses Association, as well as engaging in the medical community and issues such as cultural competence in clinical situations as well as COVID health disparities. So again, it is honored to be here to present the All of Us research. Move to the next slide, please. So we'll start with a video. I think this video is Keisha, and she's going to share a little bit about why she's involved with All of Us.
Hi, my name's Keisha. I'm a veteran ambassador with the All of Us program. The biggest benefit of the All of Us research program is that, for once, a group of researchers have actually specifically sought out the underrepresented groups in society to make sure that we're represented in research. And since that call has been placed out there that people are interested in African Americans and learning about disease process, disease progression, I think a part of that response as an African American is to stand up and say that I'm willing to participate. I signed up for the All of Us program because I represent a group that has historically been underrepresented in research, and I want to be counted, and I want to be the face that says to others who look like me, please participate and be counted.
Thank you.
Hi.
So thank you very much. And I needed to have that presentation provided to you because I can be the Keisha, and I am the Keisha, if you will. I always think of when being a part of an organization such as All of Us, and it is a National Institute of Health organization or program, if you will. I made that decision to be a part of this program and also be a lead as a chair for the board because I knew that it was important to speak up for not just the African American community, but for all communities. So I'll give you a little bit of background on why, and then I'll tell you a little bit about All of Us. My background, as mentioned earlier, and if not in detail, I focused primarily on Alzheimer's disease research prior to going into COVID. And I remember, just like Keisha, having the experience where my grandmother had been diagnosed with Alzheimer's disease. And let me stop and say that my grandmother had been diagnosed at the age of 89 years of age of actually just getting old. That was the diagnosis. And I said, no, my grandmother is not just getting old, because just 6 months ago, she talked to me as if she had a right mind. There was nothing wrong. So when the physician informed me that, well, that's what it looks like, she's getting old, you know what it is, she's 89 years old, what do you expect? I knew then that we had to speak up for the minority population so that we can recognize that just like any other ethnic group or any other older age individual, this individual was going through something. And at that time, something was identified as dementia. I wanted to be more specific, so I began to do research and recognize that it was not just dementia, it was Alzheimer's disease. And so my family and I and other providers actually began to look at how can we treat this person with not only a medicinal approach, medication, but also treat her in a way where her family's involved in her care and they understand that the disease is a disease that may impact them as well. So that's when I said we need to be more involved and we need to have a better understanding. And so again, when All of Us, National Institute of Health, began to establish the All of Us research program, I knew we had somewhat of an answer. So the All of Us research program is a historic program, is longitudinal. And what that means is long-term. It's a long-term effort to gather data for over 1 million individuals living in the United States. And it is actually individuals that obviously we can actually accelerate research and improve health. So as I go along and begin to do research with dementia or COVID, I don't have to go out and recruit. I can actually look at a bank or look into a database, if you will, and begin to recruit based on the information that others have provided in this database that I'm going to share with you. By taking into account the differences in the lifestyle, the socioeconomic, the environment, and so also the biological makeup of the individuals, we can be able to identify how we can address those needs in either a pharmacological approach or a psychosocial approach. What I look at is that the fact that individuals are what we call biopsychosocial, cultural, spiritual beings. They're all individualized, but oftentimes that cultural aspect is perhaps the ethnic cultural aspect. So we don't treat, at this time, most of our physicians are treating one size fit all. But when we look at this particular program, we see it that each individual is individualized and they're treated in a certain way. And the only way we can do that is if we follow through with research. We hope that researchers will one day uncover paths to deliver precision medicine, which I'll be talking about in a moment, or individualized prevention, treatment, and care for everyone. So this is what all of us is all about. It's not just research, but it's also understanding individuals through research. Next slide. So what is precision medicine? Precision medicine is an emerging approach, an important approach for disease treatment and prevention that takes into account, as I pointed out earlier, of the individual, their lifestyle, their socioeconomic status, their environment, and their biological makeup. So we know that this is a radical shift on how each of us can achieve the best possible care as we relate to this study. Next slide. So questions that may be answered through the all of us. How may we prevent the chronic pain that affects more than over 100 million people across the United States each year? We've talked about opioids and certain narcotics that have actually had an impact on various groups of individuals, genders, and ethnicities. But we could not answer those questions because, again, they weren't involved in research. Or may slow or potentially stop the kinds of dementia that is occurring. You all may have heard, and if you haven't, just this year in May, they just discovered a new type of dementia medication. Now, dementia medication, we haven't had a new medication in over 20 years, but just recently, I think it was May of 2021, we have a medication called Aduhelm, which actually slows the progress of dementia. They've even identified that medication 2 months later of possibly having a different impact on the African-American community. How could they have identified that? Through clinical trials and research. Or develop pain medicine that will potentially not be addictive. As I pointed out earlier, we had the opioid and our narcotic crisis. What can we do to actually prevent that? Or what are some of the things that we can do to reduce addiction? Or may develop treatments for diabetes, which affects over 10% of Americans, or may potentially prevent diabetes altogether. Or may help researchers develop more cancer cures. We've heard about cancer today. That will help them the first time, so may skip the painful trial and errors through chemotherapy. Again, all of this is being done by the precision medicine. And last but not least, or may drive sustainability interventions that may support health equity. And that's what we've been talking about for the past year or two recently. We've amplified health equity. We amplified diversity, equity, and inclusion. Now it's time to take part in research so that we can actually address those concerns in medicine. Next slide. So the innovative aspects of all of us is the diversity at the scale of 1 million or more people. So our goal is to actually have over 1 million people involved. Now, I know many of you all are thinking that should be easy, but it isn't, because a large number of our people, primarily those in the minority population, are afraid of the word research, but they're not understanding how research will truly help. We're looking at demographically, geographically, medically, and especially those who are underrepresented in the biomedical research aspect. We're looking at the diversity of data types collected longitudinal. And again, that's a long term in a clinical, environmental, genetic, behavior, and social economic status. I know in our situation, particularly in the dementia world, we often see that our family members are being more involved in research because they are hearing now that if their loved one has some form of dementia, there's a possibility of them getting dementia. Why not do it beforehand so that we'll have a better understanding before their loved ones have dementia, before they have dementia, and in fortunate situations, their children. We also want to focus on participants as partners, include the government, and we talk about that, include co-invent systems, as well as input from scientists, and as well as choice to receive data and information that you'll receive back when involved in this program. And I'll be talking about that in the next slide. And then national open resource for all, open to the public of all researchers, open source softwares and tools. I know there have been times when we've heard of studies or programs that have worked in a different state. Well, here we can actually implement those programs or studies in our own state if we're involved in some of the research that they're doing. Next slide. So what is the promise for participants? And that's participants meaning you. Well, it's the opportunity to improve health of future generations. As I pointed out, my family member has a long history of Alzheimer's disease and related dementia. Hopefully I will not, but I hope to have the opportunity to make sure that what I learned from the past and what I'm doing currently would not impact the future of my family members. A chance to learn about our own health. And so there are also free opportunities when you're involved in research with the All of Us, and I'll talk about that later. The ability to choose, access your own data, including increasingly rich health records. And we know that with the EMR, we know that we can actually retrieve some of our information, but here, not only can you retrieve some of your information, but you can also obtain information that you may have actually thought of or are interested in getting. And again, I'll share that later. An opportunity to ensure that your community is included. I think someone has said this before. I don't want to be a part of the menu. I want to be at the table to learn how I can actually help the people that I'm servicing in the community. So again, these are studies that are led to new understanding of what affects people and their health. I'll give a little commercial break by sharing that I remember lisinopril, that's a medication that's taken for high blood pressure. And again, Facebook and all the other social media platforms can really amplify certain things that may or may not be true. But I remember seeing where people of color in particular, talked about how lisinopril affected them in a different way, whether it caused swelling in their throat area or possibly strokes. Why not start looking at clinical trials and seeing what happens for a particular group of people before it's actually put out on the market and FDA approved? That's what we're looking at. A chance to learn about additional research opportunities that may be of interest to you, and the choice to meet others like you, perhaps even joining some of their and also doing research. And I think this is something that Dr. Halyard and Dr. Wise talked about with research and looking at not just cancer, but also support groups, people who are like them, and what are some of the things that they can learn from them. Next slide. So how do we get involved? And yes, I am involved because, as I've mentioned, I have family members who have a long history of a certain type of diagnosis. And so I want to look and see how that's going to impact me. It was really easy. You enroll, you actually provide a consent, and your authorization is actually identified in the EHR, which is electronic health records. Many of us are very familiar with that. We do not recruit unless you're 18 years of age or older, and it's online, it's interactive consent, and again, it includes the EHR authorization. It answers certain questions such as the basics about health, your overall health, your certain lifestyle, your health care, access and utilization to health, family medical history, personal medical history, and so on. It also looks at your physical measurements, giving you your baseline of blood pressure, heart rate, height, weight, your BMI, your hip circumference, and as well as your waist circumference. So again, you're having that baseline and you're being able to get information in real time on how that may impact certain diseases. You're also asked to give blood or saliva. I know how we are sometimes when we're giving blood and any type of DNA measure. That makes us a little apprehensive. But again, it's allowing them to understand who we are and who we are as an individual, a biopsychosocial, cultural, spiritual being, and also as an ethnicity. We're also asking for urine samples as well as biosamples that may be stored in programs biobank. Now, I want to put a little plug in. I've had people to say, do they really need this information? In some cases, you may not. We may be offering what is called qualitative research by asking questions. And again, our two presenters earlier, how can we support these individuals that may be of a different ethnic background? That can be through a survey or certain information that we're asking. Again, this may not be involved with blood or saliva, but in other areas as well. And then we also offer wearables and digital apps. We share this information. We're not tracking you. It's basically similar to a Fitbit. And then coming soon, we're integrating apps in track mode and cardiorespiratory fitness as well. So again, this is how you get involved. I'm involved currently, and I'm proud to be involved because it allows me to understand, again, the history of my family member and certain things I need to relate as it relates to health. Next slide, please. So how will all of us lead to discoveries? Well, participants share data. Participants share health data online. The data includes health surveys, as I pointed out, is actually on the EHR, and there's the electronic health records. Participants also may be asked to share physical measurements and blood and urine samples, as I pointed out earlier. And we also want to know if you would want information about your DNA. I know some people ask about that. They like to learn more about their DNA. Well, here's an opportunity to get that information directly from the study at no cost because you're being involved in the study. Research study data, researchers such as myself, to improve researchers such as use of data to conduct studies. As I mentioned earlier, there are opportunities where I'll have a potentiality to do COVID studies or Alzheimer's and other types of different studies. Instead of actually going out in the community and recruit, I'll have a database where I'll go right in and pull that information out so that I can actually conduct the study at a real-time rate. By finding the patterns of the data, we learn more about what affects people and their health, and people who are maybe individualized, as I pointed out. We also share the discovery. So all of the information is not just found, but we also what is called disseminate. We share this information through articles, presentations like we're doing today, and we also share this information with you. We may find better ways to help people stay healthy, and that's our goal, is to maintain health. Also to help create better tests. I'm going to throw in medications and other types of treatments for different people. Data is protected, and that's what we do in our research. We protect our data to make sure it's confidential, and then we also give information to our participants, as pointed out. Next slide. So again, all of us, there are over 780 different types of research projects being conducted. We explore the variety of health conditions, including breast cancer, and we also click ahead for examples of regular research highlights. So here's one of the highlights. Next slide. One of the highlights that is currently being done now is scientific questions being studied. And again, look at this. This is just scientific questions, nothing being collected. The primary purpose of the All of Us data is being investigated, basically looking at health behaviors, outcome, access, and disparities in populations. In this particular study, I, meaning the person who's doing the research, will be investigating breast cancer patients' experience to identify the patient's journey, mapping, and also valuable insights and experience for the interview that the patient provides. Anticipated findings. In the findings, this person states that they will be identifying the different emotion and experiences for breast cancer patients and different hotspots through their cancer journey. And this is so important because each, as you all know, each person does, whether it's an ethnicity, whether it's a social or biosocial background, psychosocial background, they do have a different experience. The owner of this particular study is Sophia Ortega, and also there are collaborators that are working alongside with her on this study. Next slide, please. So why join? That's what's most important. I don't know if I convinced you enough, but I know why I joined. I'll share a little bit about why it's important to join. Ensure community is represented in health research, to speed medical breakthroughs or find treatments for specific diseases, have health information in one centralized location where we're not going out trying to recruit and unfortunately cannot conduct our studies because we can't find anyone. Access results and genetic results, be considered for other research studies, and be a part of improving care for our future generation. Next slide. So why is it important for African American women to join? Particularly in this situation, as we pointed out. African American women get breast cancer at about the same rate as whites, but more likely to die. And part of it is because of the delayed care. African American people are more likely to have asthma, hypertension. We know this, we're very familiar. Diabetes, sickle cell, as well as stroke. Researchers can look at our health information to find out why. That's the most important thing. And we can help future generations in having our information included in studies. Next slide. Now we are here for our question session. I'm looking forward to having answered any of the questions in the chat or in the Q&A. So I believe our experts will be available to answer. So looking forward. Thank you. Oh, good. Questions. Okay, we have questions that are coming. Thank you. Okay. So here's a question. and I think this can go to either one of our presenters. How does stress, well, actually, Dr. Wise, how does stress play a factor in predisposition to cancer or cancer outcomes? Let's try Dr. Wise. You're on mute.
Yeah, that's a very important question. And we know that stress increases the likelihood that a person is going to develop changes in their body physiology, such as high stress hormones, that will then make them more susceptible to things like depression, as well as ulcers, as well as heart problems. So stress and depression are now very clearly understood to be linked. And stress and especially in the African American community, high blood pressure is also very, very clearly scientifically linked. So in terms of, does it affect your actual outcome from cancer? The evidence at this point seems to say probably not, at least not in a way that we can directly measure. My hunch is that it does affect cancer outcomes through the number of people who are getting depressed, because depression definitely makes for worse medical outcomes, more disease progression, and also certainly contributes to lots of other emotional struggles that that are bad for your body and bad for your mind. Dr. Halyard.
Dr. Halyard, thank you. Dr. Halyard, would you like to chime in?
Yes, people often ask, does stress cause cancer? And I don't think we have a direct link that's been scientifically proven. But as we just heard, stress really does impact quality of life. That's an area of research of mine in quality of life in cancer patients. And so the stress, anxiety, depression can really impact how a breast cancer survivor or co-supporter is living their life. And we want our survivors, and again, a survivor is defined as anybody from the date of diagnosis forward, so you can still be in your treatment and be a survivor, but we want people to not only survive, but thrive. And so really doing things to mitigate or lessen the depression, anxiety, stress, I can lead to a dramatic improvement in quality of life. Granted, it's easier said than done, but as we heard, making sure that you have adequate support system, and there's no shame in seeking mental health support. You're not weak. You'd go to your doctor if you had diabetes. You'd go to your doctor if you have high blood pressure. You need to seek a mental health provider if you've got depression, anxiety, stress, because it's not a weakness, it's a health condition.
Another question, and I've heard this a lot. We look at modifiable and immodifiable changes. Modifiable meaning things that can change, immodifiable meaning you have no control over it. And one of the most common statements that have been shared for immodifiable is diet. Are there any dietary prevention refinements you would recommend as it relates to cancer?
Yes, and particularly for breast cancer, but when we see our patients and they often ask that question, well, what can I do? And so not infrequently, we will recommend a Mediterranean diet, which is limiting meats, eating much more fresh fruits, whole grains, vegetables, olive oil, things of that nature. And you can simply Google Mediterranean diet. That really does, has been shown to have some beneficial effects, not just with breast cancer or cancer in general, but for overall health. And I think you saw in one of my slides that getting your weight into a normal range as well as exercise, those things have also been shown to be beneficial and really helping survival, particularly exercise. There's a study that shows that getting simply 3 hours of exercise a week, just a week, not a day, a week, can help improve survival. So there are some modifiable things that we can do. And sometimes people feel like, oh, I can't do all of that, but do something, right?
Yeah.
You may not be able to go the full way, but you can modify certain things and just kind of build toward a healthier lifestyle.
I appreciate that, Dr. Halyard. And I think when you say 3 hours a week, and it pretty much sums up to what some people will say, 30 to 45 minutes a day of walking. I mean, it's huge, not just for getting your circulation, decreasing your, your blood pressure chances or any other thing, and regulating your heart rate, but it also plays a huge part in situations such as cancer, dementia, et cetera. I think that's huge. I appreciate you sharing that.
And one other thing that I would say is some people say, well, I don't have 30 minutes. I don't have 30 minutes to exercise. I tell them, well, then do 3 10-minute sessions,
Yeah.
right? It doesn't have to be all in one setting.
Yes, that is a good point. Dr. Wise, I have a question for you.
Okay.
Could receiving the diagnosis of breast cancer be characterized as an inciting trauma for PTSD or an acute stress disorder?
That's a very good question. It certainly can, although when it's been studied, surprisingly, it generally is not. So that's it in a nutshell. It is traumatic, and the good news is that for most people, they find ways to process through and get support and not develop PTSD. One thing I wanted to say about diet that my patients seem to have really appreciated is that you don't have to change anything about what you eat necessarily if you learn to enjoy the taste and the flavor of what you do eat. Slow down, really enjoy each mouthful, and you'll find that your hunger and your persistence to keep eating perhaps more than would be healthy can decrease.
Thank you. Dr. Halyard, I want to try to chime into that question. I know with CBBC, you've had a lot of women, especially those of color, who have talked about their experience. I've been in some of those calls. What are some of the things that you would say relate to PTSD or some type of stress, from the diagnosis of some form of cancer?
I think as healthcare providers, there's kind of a definition of PTSD that we use, right? So when we talk about PTSD, I think we're answering it from a clinical perspective. The one thing I would say is that no one person has an exact same experience of breast cancer as another.
Yes.
So there are some people who get their diagnosis, they never miss a beat, they don't worry about dying, they keep going, and they show nothing. And there are other people that are the exact opposite. There's some people in whom they can go through their breast cancer treatment, be cured of it, and tuck it away and never think about it again. And there are other people who there are certain things that trigger, or it's always sitting in the back of their mind. So I think that it's important to recognize that, one size doesn't fit all. Everybody handles it differently. And there may be people that are triggered by coming back into, for example, the clinical environment. They kind of think, oh my gosh, this is where I got my radiation, or this is where I got my chemotherapy. I don't really want to be here, right? So sometimes patients have that. Sometimes patients are anxious, particularly breast cancer survivors, when they have to go get their follow-up mammogram every year. They've had breast conserving surgery. So there are things that can really trigger some of these anxious emotions. But from our CBBC breast cancer support groups meetings, we see the wide gamut. But I would say the vast majority of women are doing well, but they're different. So they talk about a new normal, right? You can't ever go back to pre-breast cancer.
Yeah.
And so we also hear for a number of women, that their life post-breast cancer diagnosis, because of changes and choices that they made post-diagnosis, is actually better and more fulfilling than pre.
Thank you. I appreciate that. Do you see the same anxiety with their family members? In some situations you hear someone's been diagnosed, like a mom or grandmother with breast cancer. Does that anxiety transfer over to family members as well?
It certainly can. And again, there's a wide variety of responses, but co-survivors, family members, loved ones, supporters, they go through it too. And they too have their own stress and anxiety that occurs as well in many instances. So it is really important to pay attention and to support the caregivers as well.
You know, for our listeners, I think when you talk about they too have their own stress and anxiety, you're absolutely right. It could be the fact that they're concerned whether they're going to get it because it's actually someone in their family. It also can be the fact that they feel like they're going to lose that individual because that's a big word, cancer. And so again, we have to cater to what they're going through as caregivers and as family members and be able to support them as well. And that's one of the reasons why I really love CBBC, because it doesn't just look at the individual, it also looks at the individual and their families as well. Here's another question. Does menopausal hormone use lower risk on all types of breast cancer?
So postmenopausal hormone use actually has potentially can raise the risk. And so when we saw hormone use decline in the United States, we actually saw the incidence of breast cancer go down. Now, sometimes we will talk about as oncologists hormone therapy for breast cancer, which is not giving female estrogen and progesterone. It is giving pills that block or shots that block the hormones in the body, shutting off either ovarian function or other forms of estrogen. So I'm not sure if you're talking about the hormones that people take to combat menopausal symptoms, and that can potentially increase the risk of breast cancer. But the hormonal therapy that we use, which is really a hormone blocker therapy, can lower the risk of all hormone receptor positive breast cancers. Triple negative breast cancers do not have receptors, little proteins that kind of take it, that are kind of stirred on by the female hormones. So they do not respond to that type of anti-hormone therapy. I think that's what the question was asking.
Yeah, I believe that's where they were going with that. Let me see. I think we have another question here. How do you deal with the mental side? I think Dr. Weiss is for you. How do you deal with the mental side of possibly having breast cancer in your family? I think it's very similar to what was shared earlier. Stress of genetic concern, possibly. That's one of the questions that someone's asking.
Yes. Well, one way to deal with it is to sign up to be a participant in all of us, and then you can be contributing something with the stress that you have from living with it. And taking it from the standpoint of how to cope with that risk, there are several programs now, one at the University of Arizona Breast Cancer, for people with family members who have cancer. So you can actually come in and get a consultation and get tested to see if you have a particular breast cancer gene called the BRCA1 gene that is known to put you at higher risk. So one thing you can do is just go and get a consultation, find out what kind of risk you actually have in order to not just feel paralyzed and hopeless, but rather to learn more and therefore be able to take actions. If you have a BRCA gene, then you're going to need to get screened more often, and you're going to need to think about interventions that might be important to increase your lifespan. So yeah, it's a complicated issue. And I think another thing from an emotional perspective has to do with young people who've lost their mom or their grandmother, who were very, very important caregivers for them, and the impact that has just in terms of their own sense of vulnerability. Like, I lost my mom and my kids could lose me. So that might be a question for a counselor.
Yeah. So I'd like to see if Dr. Halyard can chime in on that. as
Yeah,
well. Thank
following
you.
up, one of the things that I think is really important to understand is that only 5 to 10% of breast cancers that are diagnosed based on what we know today have a genetic component to it. So often women will say, I didn't think I was at risk for breast cancer because nobody in my family had breast cancer. And yeah, that's right. About 90 to 95% of the cases that we diagnose, there is not a genetic link. There may be other members in your family that develop breast cancer at an older age, but that was what we called sporadic. We cannot identify a gene. And when you ask about how do people deal with the stress, people deal in different ways. My mother had premenopausal breast cancer. I was 5 and she was 43 when she developed her breast cancer. And I had many women in my family as they got older that had breast cancer. And one day, and I'm ashamed to admit it, relatively recently, I thought, you probably should get genetic testing. Now, mind you, I'm an oncologist, but I just kind of put it out of my mind. I didn't think about this. But so people deal with it in very, very different ways. About this genetics, but it is important to know. And if you have any concern, as Dr. Weiss said, go and get genetic testing if you have a mother or a sister or multiple family members, particularly with early onset breast cancer in young ages. The genetic counselors ask you your family history. And it is important to know your family history because we as Black people don't necessarily know our family history. We don't necessarily talk about the cancers in our family. And that is important to know because that can give a clue to a genetic counselor that perhaps you do need to be tested because, oh, you actually had a grandmother and an aunt with breast cancer. You had a grandfather and an uncle with young onset prostate cancer. You had colon cancer in your family. And it's not just breast cancer history that's important to know, it's all the cancers in your family.
Yeah, I think that's a very important thing to talk about, not just cancer, all different types of diseases. Because like I said, in my family, who would have thought dementia? And then as I began to reflect on different family members, I realized that was in our family. As also just want to share with our listeners, as part of a participant in the All of Us research, you can also get genetic results returned to you, including the BRCA gene, if you are a participant in the All of Us research. That gives you an opportunity, again, to be a part of the research study, but also remember what I shared. It's not just being part of the study, but it's also getting information about your family history on different things as it relates to, obviously your history. Again, if you're interested in being part of one of the largest and most diverse research program, which is All of Us, we encourage you to visit All of Us, and that is all ALLOFUS.AZ. So it's allofusaz.org, or you can also call 1-877-268-2684. And it's very easy. If you can actually even Google it online and just put in All of Us, it will populate. And again, Arizona, every state pretty much has an All of Us team, and so we're part of it. Are there anything else you'd like to share? I know that as part of this wonderful platform, I'm really excited to have you all on this platform and also partnering with All of Us. I know our listeners have learned so much. I think one of the greatest concerns, and Dr. Halyard, I've heard you speak of this, is that we're equal when it comes to having breast cancer, but we delay our screening. We delay that, and that unfortunately puts us in a situation where, as African Americans and other minority population, we obviously may actually catch it a little bit too late. So can you talk a little bit about that? That's one of the things I really want to emphasize on as we wrap up.
Early diagnosis is the key. And early diagnosis is the key to surviving breast cancer. So don't be afraid, be an advocate. If you know something is wrong, check it out and don't stop until you get an answer. Don't be afraid of getting a mammogram. If you're of age to get one, get your mammogram. Know what your body looks like and feels like, what your breasts look and feel like, and pursue anything that seems wrong. And again, if you have breast cancer, please come and join us at the Coalition of Blacks Against Breast Cancer. If you are part of an organization that wants some education, we go out into the community and we educate about breast cancer awareness, diagnosis, treatment, and survivorship. So all you have to do is invite us and we'll show up with a team of folks that can give a lot of great information. So thanks for creating this opportunity this evening, Dr. Allen, for sharing important information in the community.
No, I thank you. I really appreciate it. I also want to share with those before Dr. Wise speak is that we get our blood pressure checked all the time. We get our blood glucose levels checked quite often, right? So here's another screening, an opportunity for us to check our body in other ways. I know we've heard the story about, oh, I don't want to get the mammogram because the way it squeezed my breast. Well, I'd rather for something to squeeze my breast so that I can know that I am okay than to wait too late and have some uncomfortable situations such as we pointed out today. So it leads me to Dr. Wise. Those uncomfortable situations has caused us to have anxiety, depression, and other concerns. Do you have any closing statements as we wrap up, Dr. Wise?
Well, yes, just to echo my great pleasure in being part of this panel. I really appreciate the organizers for inviting me and giving me a chance to talk about something that I care so much about. As you were talking about your organization, I realized that there's another opportunity I'd like people to know about at the University of Arizona Cancer Center. We have an office for outreach and community engagement. And we're starting a program that I actually studied called Abrazo. And it means a hug for the family. And it was specifically designed by a colleague of mine whose father got cancer, and she realized that she just didn't know enough about how to proceed, how to work the medical system, how to understand the language. So she started this program, which is a education and support intervention for family members who want to learn more about how to support a loved one. The very basics of understanding cancer, understanding the healthcare system, understanding how to advocate for yourself and your family members. It's called Abrazo, A-B-R-A-Z-O, Abrazo. And it's going to be offered through the community outreach branch of the Arizona Cancer Center.
Excellent. Well, thank you. So for all of our listeners, those who are actually on the Zoom, those who are on Facebook Live and all the other social media platforms, we're going to encourage you to fill out a survey. It's actually a webinar survey. It should be in the link now. And if you could take a moment to click on that survey, complete it, and return it to us. We're also going to encourage you, this is recorded, that you share this information about breast cancer and also all of us, breast cancer and the impact it has on the minority population, cancer as a whole, talk about the different programs, the CBBC and CBPC, that's a new program that's coming out for prostate cancer, and also talk about some of the information that Dr. Wise shared and Abrazo. We also want to encourage you, more importantly, to get involved in the All of Us research so that we can know what we are about yesterday, today, and also in the future. We're also going to ask that you share your link. What do they say? Click like, share. Share your link. This is actually Breast Cancer Month. And as we know, for some of our survivors and our supporters, every month is Breast Cancer Month, but we are amplifying it because of this month being the National Health Month of Breast Cancer. We're asking that, and cancer as a whole, we're asking that people please take these links, send them out to family members, friends, let them take a moment to listen, point out some of the highlights that have been shared by our experts. It is so important that we, as people of color and just people as a whole, look into ourselves and recognize that we need to look at how we can prevent certain diseases occurring and also death, unfortunately, and treat these diseases as well as prepare our loved ones for what's going to come ahead. So again, we thank you. If there are no other closing statements, I believe
I'm going to add one more thing.
Absolutely.
With your description of the online access, it
Yeah.
just reminded me that one thing we didn't touch on is how people get information about cancer and breast cancer,
That's a good one.
because it can be very scary if you just
Mhm.
Google breast cancer to find some sites that really aren't credible and
Right.
that can be very misleading, about miracle cures or interventions that are alternative but haven't been
Mhm.
studied. So I'd like to really just let people know that the National Cancer Institute, NCI, is a wonderful source of information, and there's lots of information for survivors and co-survivors. Another really great place to go for information is the American Cancer Society.
Mhm. Yes.
So National Cancer Institute, American Cancer Society, really, really important sources of information that you can trust. And if you are wanting to learn, I would really recommend that you go to those places, stay off the general Google world, because there's just too much scary and incorrect information out there.
Adequate, yeah. So inadequate information has been provided, and we've seen that with the COVID as well. I think this is very important to encourage our listeners. These are experts. These are physicians that are working in this area. Myself as a researcher working in the area, to make sure that you are well aware of what's going on. We encourage credible information. Most of our information is from scientists, research scientists, as you know, CDC, NIH, and all the other credible resources that have been provided. We do have some of this information in the chat. So if you are on Zoom or on Facebook, please click on those areas. We also have, again, thank you for attending this event. We have a barcode so that you can go directly to the All of Us Research website to learn more about us, as well as visiting our website and also calling in. And then, of course, at a national level, recognizing the National Institute of Health and the All of Us program. So again, thank you, thank you, thank you. It was an honor to actually be part of this platform and also hosting this event. So again, we look forward to meeting again. I know we will. And take care. Have a great evening, everyone.
Thanks.